name's Lauren. I'm going to be your nurse today. The doctor has ordered for me to do a head-to-toe exam, so we're going to go ahead and do that. Can you please tell me your name and date of birth?
Yeah, my name is Linda Noala, and my date of birth is July 29, 1995.
Okay, I'm going to verify that with your wristband. Thank you.
Okay.
While I'm washing my hands, can you tell me who the president is?
It's what's his name? Donald Trump.
And then do you know what today's date is?
Today is the 23rd
Of?
of May. Sorry, April.
Okay. I'm going to put my gloves on, and then I'm going to go ahead and raise your bed up so that I have you at a good height so that we can do our examination. It does look like you have good hygiene. Can you go ahead and take your jacket off for me?
Okay.
I don't smell any odor. Can you tell me your height and weight?
I'm 5'7", 5'7" and I weigh about 115 pounds.
Okay. So your height and weight is good, and you're not using any walkers or any mobility aids, okay? I'm going to go ahead and check your posture. Looks like you have a normal double S curve. Your skin seems warm and hydrated. I'm going to check the turgor. Good. I don't see any wounds or sores. I'm going to examine your nails for clubbing, and I don't see any kind of clubbing present. Now we're going to check your capillary refill, and it seemed to be less than 3 seconds. On a scale of 0 to 10, are you having any pain?
No, I don't have it.
Okay. And so your vital signs came back normal. 120/80 was your blood pressure, 98 degrees temperature. Your oxygen was stating at 100, 16 respirations per minute, and 70 was your heart rate, 70 beats per minute.
Okay.
So now we're going to look at your eyes, and I have all my tools right here. We're going to go ahead and check your pupil reactions, your pupillary reaction. So I'm going to cover one of your eyes. And both eyes should react. Good. So your pupils equal round, reactive to light, and accommodation. Your consensual response is when I cover one of the eye and shine the light into the other, and they react the same. Your eyes are symmetrical. I don't see any drooping of the eyelids. Now we're going to test for your 6 cardinal fields of gaze to make sure that your extraocular movements are intact. So you're just going to follow my finger. We're going to go this way. Good. All right, so next is the ears. So I'm going to use the otoscope to check to make sure that your ears are clear of any drainage or cerumen. Okay, good. I don't notice anything coming out of your ears, anything abnormal. I am going to go behind you. We're going to do a little hearing test.
Okay.
Can you hear that?
Mm-hmm.
Can you hear that?
Yes.
All right. Okay, so hearing is intact. Your ears are symmetrical. Next, we're going to look at your nose. Your nose seems to be midline. We're going to have you smell an expo marker. And, well, I just told you what it was. Anyways, go ahead and see if you can smell this.
Mm-hmm.
Okay? And it smells like expo marker to you? Okay. The nares patency is good. It looks like you're oxygenating good with your nose movement. Okay, can you open your mouth? We're going to make sure everything is good in your mouth. I'm going to shine a light. Looks like all the teeth are intact. Can you swallow for me? Okay, and I did notice the movement of your esophagus. Okay, and we are going to palpate the lymph nodes. Can you tell me if you feel any tenderness? No tenderness? Okay. Well, it looks like your respiratory effort is effortless. You're not using any of your accessory muscles.
No.
Now we're going to auscultate your breath sounds. So you have 10 spots that I'm going to check for in the front. You have 18 in the back, and then on the sides you have 4. We're going to make sure that there's not any adventitious sounds. So popping and wheezing, which would probably indicate any kind of a crackle or rail. And then after that, we're going to look at your back. Okay. Deep breath. 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 Okay, sounds clear in the front. I'm going to move to the back. Deep breath. 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 Are you feeling okay?
Mm-hmm.
Okay, deep breath. Deep breath. And one more. All right, so the breath sounds are good on the back side. Let's see. I'm going to listen to the lateral. All right, so I don't notice any adventitious sounds. I'm going to inspect your back now. We want to make sure that there's no lordosis, which is going to be an excessive inward curve. And we don't want any kyphosis, which is oftentimes like a hunchback or a round back. And scoliosis, which would be an abnormal curvature of your back to either the right or the left. And from the side, I don't notice any of that. I see a normal curve at the neck and a normal S curve on the back. I'm going to assess to make sure the spine is midline. No abnormal curve there. Very good. Okay, and so now I'm going to make sure that we don't have any ecchymosis or bruising. We don't want any arrhythmia or redness. I don't notice any jaundice or a yellow tint. There's no petechiae, which would be small, round, purple-brown dots, which would indicate abnormal bleeding underneath the skin. And I don't see any decubitus or bed sores anywhere. We did say already that your skin turgor is good. I didn't notice any skin tinting, which would be when I pinch your skin, the skin wouldn't return back to the normal position. We already inspected the back, and now we're going to auscultate your heart sounds at the point of maximum impulse. I'm going to determine your apical rate, which is going to take 1 minute. Okay, very good. And I've located your aortic, your pulmonic, your tricuspid, and your mitral valves. Everything sounds normal there. We already tested for your skin turgor, and as I said before, you are hydrated, so that's good. Now we're going to assess the limbs of your body. We're going to make sure that you have good strength bilaterally in both of your arms and your legs. I want to also make sure that the temperature and the everything like that is good. So I'm going to have you pull against me with your hands. Okay, now you're going to push. Okay, and then do the same with your feet. So you're going to pull towards you. Good. Now push. Very good. So you are equally strength in your arms and legs, which is good. Now the temperature of your arms and legs, warm. My fingers are probably cold, I'm sorry. Okay, good. All right, so can you lay down for me? I'm going to inspect your abdomen. I'll put that over there for you. Okay, so looking from side to side, I don't see any distension of the abdomen. I am going to auscultate your bowel sounds in the right lower quadrant, the right upper quadrant, left upper quadrant, and left lower, so all 4 quadrants. So we have bowel sounds present in all 4 quadrants. Can you tell me when your last bowel movement was?
That was yesterday.
Okay. And then, are you having a normal menstrual cycle? When was the last menstrual cycle that you had?
That was last month, the end of last month, but I can't remember the date.
Okay, but it's normally pretty regular for you.
Yeah.
Good. Okay, so I am going to palpate and note the strength of your radial pulse. So we have a good pulse there, it's not bounding. And then all of your upper body peripheral pulses, which would be your temporal, your aortic, radial, apical, and brachial. Now you can go ahead and sit up for me. Okay, and I'm going to just do a few last things. I'm going to assess for, here, can I have you turn over here this way for me? So we're going to palpate and note the strength of your pedal pulses, and all the lower peripheral pulses, which would be your femoral, your dorsalis pedis, your popliteal, and your tibial. So the pulse is strong and equal bilaterally. I don't see any edema in the lower extremities of your body. Edema meaning swelling. And I don't see any pitting in the legs, ankle, or feet. All right. Well, that's all for today. Thank you, Miss Linda. I'm going to position you with the 3 bed rails up, your colleagues right here, and I'm going to lower your bed and wash my hands. Thank you.
Thank you.